My name is David Ben Odafe. I'm from Nigeria. I live in Lagos actually. And I came to India for medical treatment, specifically scoliosis. I have sickle cell anemia, and I just been diagnosed of adult idiopathic scoliosis, which is a curvature of my spine, and the problem has been on for quite a while now, about 15 years, and I've been trying to get all the medical opinions and solutions I could get, so that I will finally put this behind me. I started making inquiries. My doctors back home, they recommended the scoliosis corrective surgery, which can't be done in my country, Nigeria. So I started searching the internet. I came across several hospitals in India. I've always heard of India that medically I can count on them. So I wrote about 15 of them. Every other person I wrote, the reply I got wasn't so encouraging. They were all trying to, compound my own problem, telling me how severe it is and the underlying sickle cell anemia, So I wasn't ready to listen to all those stuff. I just want a straightforward answer. Yes, we could do it. This is what it will cost. This is what is involved. That was what I was waiting for. So I got this mail from Aarex Medical Services, and the first thing that got me very interested in this particular medical services was that he first empathized with me. He said something in the mail that I'm sorry that you have to go through what you're going through presently. You're a young man, you have so many years ahead of you. He said, don't worry, we'll get a solution to this. And that calmed my fears. He put me at a state of rest, and from then I knew I could count on them. So then he told me that the surgeon was away on tour in the United States, but he will be able to contact him and get me his opinion. So 2 days later he got me his opinion, and we started working on it. Since I arrived here in India, right from the airport, when I was picked up, till when I was lodged into the hotel, till when I was admitted into the hospital, when it's been into Manipur Hospital, it's been a wonderful experience. I never expected everything to go so smooth, so easy for me. Coming to a country where I knew nobody, and again I have medical issues, but they just made everything easy for me. The MIPC team, Gita, Sarika, and the others, were very wonderful, very receptive, very friendly, hospitable. They all make everything wonderful for me. And my impression about Manipur Hospital at first, Aarex Medical Service sent me their website, so I read some stuff about them, and I knew that I'm in the right hands. So when I came here, I met my surgeon, Dr. Vidyada, and he told me, he just looked at me and said, okay, we'll do the surgery the next day. We just have to do some couple of tests and stuff like that. And we started that, we're doing all those tests and stuff, and we discovered some other complications, and we couldn't do the surgery the next day as planned. And I discovered that he's a very excellent surgeon. He certainly knows his onions. I've interacted with other spinal surgeons before I came. I have sampled their opinions. What they told me were entirely different from what this young surgeon told me. First, he was very young, younger than every other one that I have interacted with. But I always knew that good things comes with those that are young. They are in tune with technology and the advancement in the medical world more than the old ones. So I was expecting the best from him, and I read his CV, and I knew I'm going to be treated by the best. So he was friendly, humorous, gentle and kind-hearted. He just made all my worries go. He has a way of getting into your heart. He just like the sunshine, just made me happy. That everything is gonna be all right. I have nothing to worry about, and the accommodation outside the hospitals were wonderful, comfortable, affordable, and very safe. My impression about India, before I came, I heard a lot about India, the second most populous country on earth, so many people, so many stuff like that. And what I was expecting was like China became the manufacturing hub of the world today. I think India has become the hospital of the world. Everybody's coming to India to get medical treatment. They're coming from America, they're coming from the Middle East, they're coming from Africa, from everywhere. So I think India has become the hospital of the world, if I could say that. And I was well looked after. I felt safe. I never felt threatened or in danger anyway. In the hospital, the nurses, they were all friendly. They were just a wonderful team. My friends and family back home, I will actually recommend Manipal Hospital. There is something about this hospital. It's not just like business as usual. Like my surgeon told me the first day, he said, David, we're not doing business here. He said, we're guided by the fear of God, and that really got into me. He's the first surgeon to really come to me in a personal level and really talk to me like that. And Mr. Ramesh, my facilitator in Aarex medical service, when we were communicating, he gave me the impression that everything is going to be totally fine. I have no worries, I have no trouble. And what I meant or grand, I think is more than the impression he gave me. Everything was fabulous, wonderful. The treatment I got was excellent. I could walk the very next day. I never expected it. Every other surgeon that I interacted with, they told me that I've been incapacitated for 7 months. That was what I was expecting, to be incapacitated for maybe for 7 months. And I was feeling so amazed when the very next day after surgery I could stand up on my feet, I could move around. After a major spinal surgery, I think they did a very, very excellent job to me. A very wonderful job, and I would like to thank them, the surgeons, the MIPC team, the Mr. Ramesh, for recommending this hospital to me, Manipal Hospital, the staffs, the nurses, and everybody. I'm grateful. They did a wonderful work for me. Thank you.
Ben Odafe, he came to us, I think, a week back, wherein he was 33-year-old and he was suffering from scoliosis for more than 15 years, and it was progressive. He on and off suffered from breathlessness and some respiratory compromise, and that's when we thought he needs a surgical intervention. And he was diagnosed to have adult rigid right thoracic scoliosis, and his MRI was normal. He is a known case of sickle cell disease, with the sickle cell concentration in the hemoglobin was 40%, which is definitely not something that you can operate with. So we had to do 2 exchange transfusions before we could even think of surgery. When he presented to us, he had 3 curves. His right shoulder was high, his right pelvis was higher, and his main right thoracic scoliosis, which spanned from T5 to L1, measured 70 degrees, and on side bending it unbent to 50 degrees. He had also got a flexible lumbar curve and a flexible proximal thoracic curve, which we decided to leave them alone as they were not very rigid and they could remodel over a period of time given a chance. And fusing the lumbar curve would definitely make him more stiffer, and he would lose more than 50% of his flexibility over the lumbar spine. And hence we thought we would use the best of implants and get him the correction of only the main thoracic curve. This is his pre-op radiograph, and you can see here the curve from T5 to L1 measured 70 degrees. The proximal thoracic curve from T1 to T5 measured 33 degrees, and the lumbar curve from L1 to L5 measured 40 degrees. On side bending, you can see the main thoracic was very rigid. It was unbending to only 50 degrees, whereas the lumbar curve was unbending to 21 degrees and the proximal thoracic to 13 degrees. And we did the surgery, which is posterior only approach, wherein we put pedicle screws at multiple levels using Globus Medical, which are the titanium implants procured from the United States of America, and we have good reduction devices. And in addition, at the apex of the curve, we had to do 2 Pontier osteotomies to get a better correction because it was a very rigid curve. In the past, similar curves which were very rigid, people would do an anterior release followed by a posterior surgery, but today, depending on the technology available and the strength of the implants, we are very sure that we can get good reduction. Like you can see in this X-ray that was taken after 4 days, the patient standing, and you can see the curve has actually from T5 to L1 reduced to around 18 degrees, and interestingly the lumbar curve has already fallen back to 18 degrees, which is less than even pre-op unbending film, and the proximal thoracic as well, which was unbending to 10 degrees. And this is how it looks. You can see initially the right shoulder was higher, and now both the shoulders appear to be parallel. The pelvis was parallel then and parallel now, and look at the correction. It is quite phenomenal. We have actually achieved more than 75% of correction safely, with the patient still able to walk on the very same day after surgery without a brace. It is such a strong fixation that we can allow him to even play football in the next few days if he can. And this is the table wherein you can see the correction. 70-degree curve, which on flexing was unbending only to 50 degree. Now with the instrumentation we could achieve further correction up to 18 degrees, and these proximal thoracic and the lumbar curves, which were flexible to begin with, became more correctable after the correction of the main thoracic curves. And patient is doing well. I think that itself signifies that these are the complicated cases, because patient with sickle cell anemia, you need a very good infrastructure, you need a good hematologist to take care of the hematological parameters, give you a good enough safe zone so that you can work around, do what you want to do. Otherwise, in a smaller setup with people having no backups, I think it is not a good thing to do these kind of surgeries. One of the most dreaded complications of this surgery would be paralysis, but we have today neuromonitoring, which makes it all the more safe, and we can detect if at all there are any changes on the neuromonitors, and we can always reverse the things. And David, the other aspect which I would like to highlight is he came all alone, such a strong boy. I guess I wouldn't do it for myself, and he came alone, he withstood the surgery well, and I think today he is smiling. That itself is a biggest gratitude I can ask from him.